7 o'clock on the dot. Good evening, pre-health, Hopkins pre-health community. I'm Ms. Zuri from the Office of Pre-Professional Programs and Advising. And today is our last, for the semester, not forever, Pre-Prof Talks live. And today we have a current student with us. Yay. There she is. So I am going to, yay. Did I accept it? Oh no. Invite. Okay, I think it's coming. Oh, there you are. Awesome blossom. Okay, there you go. Thank you, Zandy, for joining us on our last Instagram live pre-prof talks of our pilot program situation for the spring. So very grateful taking this time out of your evening. Hope all is well so far. Finals are about to get started.
Reading week is next week, and then I have finals both week 1 and week 2. So yeah, lots.
Okay, cool. So we're gonna get into it. Basically, just a couple questions about. We're gonna just talk about the pre-health journey so far for you. Definitely gonna ask you about your experiences in different realms, whether in the classroom, extracurriculars, things that you've done. Highlight some wins for you so far here at Hopkins, and then also like what does the future hold in terms of things that you see yourself doing within the health profession. So first, tell all the people what year you are, what's your major.
Okay. Hi everyone. My name is Zandy. My pronouns are she, her, hers. I am a junior. I study public health here, and that's it. On a pre-med track, and I am from Alexandria, Virginia, which is right outside of Washington, D.C.
Okay, nice. So I love that you said that's it. The double majoring situation is very, very common here with the Hopkins students. So you guys are on that definitely like advanced brilliant path in many ways. But so public health only, but public health is a hefty major. So tell us what drew you to public health and what are the areas that you are most
So
excited
I
about?
came into college, and Hopkins specifically, I wasn't pre-med, I was actually computer science. I switched majors a lot. I switched from computer science to neuroscience to history, and finally public health. And I have always had a love of working with people and really connecting to them historically and in the present as well. And I found a lot of that my work in my first years of college, freshman and sophomore year, actually really surrounded policy work and epidemiology work. So public health, I eventually switched to halfway during my sophomore year. And it became a really good fit for being able to apply my writing skills to really try to answer questions that affect people every day on such a huge scale.
Okay, all right. And so you identified two skills, like one, writing and being able to communicate ideas in like not just verbally but written form, and then two, realizing that helping people could take very different structures, so policy being one way. And so what is right now, as of the experiences you've had, and we'll talk about some of the experiences after, but like what why medicine?
Oh gosh.
Why
Yeah, I don't think I really decided to be pre-med and do medicine until actually just past winter break. I had been taking pre-med coursework, but kind of getting discouraged. Like I went through Orgo, I was like, oh shoot, why am I here? Why do I want to be a doctor? What happened? I worked a lot in policy settings and accessibility settings, and trying to create change on a really huge level, on like a policy level, on a systems level. And that change takes a long time to happen. And I realized that, people kind of need direct change and direct service work as well. And I realized that, maybe I couldn't make such a big difference on a policy level, but I could certainly still be an advocate there for my patients, very willing to help them. I describe like why I want to go into medicine is because I want to be the parachute for people who feel like they're falling. My worst fear is the fear of falling, because when you're falling, you don't know when you're going to hit the ground. And there's this feeling of feeling really helpless. And I think as a medical professional, anyone that's working in the healthcare field, you're really responsible for being a guiding source and a source of comfort as someone is going through a health crisis and trying to cushion their fall, if not stop it completely. And so I feel really grateful that, you know, hopefully as a future medical professional, I can be there as an advocate to really work on the policy side and in the research side as well. Also just provide that direct one-to-one connection with my patients and really help them. Yeah. Yeah.
Okay. I love it. I love the personal connection, like your own personal narrative wrapped up in your own fears and how you want to reduce that and mitigate that for other people, in the like the peripheral, like bigger sense of healthcare. So don't y'all be stealing her parachute
Oh,
stuff.
my experience I want to tell you about, because this relates a lot to my other work I do right now. I think the big experience that, you know, really started me on a path for medicine, but not directly, is that when I was 12, I got this special hearing aid called a Baha implant. It basically helps sound bypass the damaged middle ear, which goes on my left ear. And I remember stepping out, it was after surgery, I had to get like head surgery for it. I didn't have hair for like a week or so. It was kind of strange. But anyways, once I got it installed, I'm based in DC. I stepped outside DC office and it was cherry blossom season. And I heard birds chirp for the first time. And I had never heard birds chirp for the first time. And I don't know, Zuri, if you're a parent or not, but it's like hearing your kids laugh for the first time. It's so dull and so familiar. But, you know, you kind of just cherish those moments forever. So I didn't know that I wanted to be a doctor at the time because I didn't see many doctors with disabilities in the field. But I did know that I wanted to help people with disabilities have that moment of joy and have that watershed moment. And I was looking for something that could really help me work towards helping people both on an individual level and really a systematic level, which I hope to do as a doctor. Yeah.
Okay. I love it. I love it. Yes. Wow. That's I feel like that story in itself sheds the light behind some of your passions and why you're pursuing them so intently. So I guess like talk about, you know, during the application process, we've kind of shared about you'll be choosing 3 most meaningfuls and things like that, and some of those reasons why. And when you think about some of the activities you've done, extracurricular research, you know, volunteering, what are 2 or 3 experiences that you feel like have been really instrumental into like solidifying your decision?
Oh gosh.
And your pursuit?
I guess the first one, I recently started, I had done some volunteer work in the past, but I was at the emergency department, and it's kind of hard to, as a volunteer, not really doing much, to go in and go talk to people that are in crisis. But I eventually transferred over to MedStar and started volunteering there. And I just go in and check on the patients, round on them. For rounding, for people who don't know, it's really just checking in on them, seeing if their care team's been there to see them, see them need food or water. But why I enjoyed it so much is that there's less patients there, so we're able to talk to them for much longer and able to build connections with them. One story, I'm going to tell a quick story because I love stories. There was a patient in 702, and I was talking to her for an hour and a half. I told her, oh, my boyfriend's going to be here tomorrow. And then the boyfriend came in the next day. And then the patient 702, old lady, told my boyfriend, what was it? And he's like, oh, yeah, she's just like me. She's a nut. And I, oh, wow. Yeah, yeah. So, you know, moments like those, it really reminds you why you're doing this. It reminds you that you're human and that you just want to help people feel like they're seen in the health system, which is something you don't often see very well. It's hard, you know, there's challenges, of course, but that's the big reason why I want to do medicine.
Right.
And the 2 other experiences, I guess they're both ABSI related. One, I started Next Gen Accessibility Initiative, which has helped over 200,000 students across like 119 countries have access to accessible education. And it's kind of a passion project of mine because it has nothing to do with pre-med, but I think I told Ellen this one time. I was like, why wait until I'm a doctor to change the world? Like, go in with that gumption. It was a lot of fun. You know, I learned that I had the resources and the voices and the perspective as a youth to really inform huge educational systems. And so with that, I've been able to work on accessible medical school curriculum with the Hopkins School of Medicine. I've created toolkits with the U.S. Department of Labor. I've done a lot of work with organizations around the world. So it's really empowering to see how much change you can do at such a young age. And I hope you continue doing that in the future. So yeah.
Exciting.
Oh, the third.
And then you said one more. You said
Yeah.
so that's
When I do neuroscience research in Dr. Amanda Lauer's lab, and I love working with mice. I love doing historical research, and I'm very grateful she's given me a huge variety of research that I can do. But it's just really exciting that I never knew what research was before I got to Hopkins, and it was like, okay, I want to do research, but I have no idea what it is. But you know, my PI and the grad students gave me had so much faith in me, and just threw a project at me, and it's been quite an experience to just grow and learn really quickly. So yeah.
Okay. So you got a little bit of everything. You have that very direct humanistic part of the side of medicine that you really are drawn to. And then you have the curiosity of wanting to understand problems, not just at the surface level, but understand them enough to build actual solutions towards them. And then there's that innovator entrepreneurial spirit of like, why wait, do it now, like, you know, kind of thing. So I love it. So then the question, I guess, too, is well, I want to get to you were recently awarded something for work that you've been doing. Were they connected to the specific project that you've been working on, or was that something else? You were recognized.
The Human Armstrong? Okay, so yes, I won the Human Armstrong Award in fall 2022. It recognized me as one of the top 6 youth disability advocates in the nation, which was really exciting. It's named after Elijah Armstrong and Judy Heumann. Judy Heumann is like the Beyonce of the disability rights movement. She passed away recently, which was really sad. But basically, they're recognizing students who have faced ableism, basically discrimination because of disability in the classroom, and recognizing students who have been able to rise up that and try to change systems that they're a part of. So yeah, I guess a big part of my application and a big part of why I won the award, because of my efforts to really, like, disability work is often only seen as the responsibility of the disability community, like me. I identify as disabled. But, you know, with my work, I'm trying to help youth and educators understand that, you know, you don't need to know how to code, you don't need to know how to program to totally make the world a more accessible place. There's individual tricks that you can do to make the world more accessible. I'm just trying to empower people to really realize the importance of accessibility and that they had the power to create a more accessible world. So yeah, that's why I won the award, but it was a great honor to, one, meet Judy before she passed away, and just include one of my very important identities to me in the work that I'm doing. So yeah, it was an honor to win that award.
Right. Okay. I love that you said one of the many identities. And I think when we talk about being a compelling applicant, a lot of times students are thinking of themselves as being a unicorn of some sort, like no one else in the applicant pool is going to look like me. And the shocking reality is that a lot of pre-med students, pre-health students have a lot of the same overlapping experiences that they've chosen to do. But what makes you are the intersectionalities of the identities that you hold personally and experientially. And so when you think about yourself, I actually had this one. I guess besides the common pre-med or pre-health, and your voyage was a little different, right? Because you came in with a different goal in mind, and pre-med has been more solidified through the activities and things that you've been doing. But what other experiences that are sometimes less common in the pre-med conversation have you been really engaged in that you find great passion for, or just excited about personally?
I guess to your first part of the question, you know, how does my many identities kind of like play into it? I find myself, because I'm able to be both an advocate and a scientist, I kind of quote it like I'm able to bring the tangible data of research and the intangible data of stories and merging them together to really become a better scientist advocate, really advocate for policies that are going to help uplift the disability community. But as far as experiences that are outside the pre-med journey, that, you know, don't normally happen. I've been lucky enough to intern in the U.S. Congress. I think Christine's on the call, so I better shout her out. She's the American Association of People with Disabilities internship program, and they placed me with U.S. Representative Katie Porter from California. I was able to help her team with some accessible social media stuff and some policy stuff, disability policy, like accessible social media for federal agencies that we worked on. And so, you know, most pre-med students don't do that. I went to dinners there and I was like, you're a pre-med student. What are you doing here? It's St. Orgo or something like that. But how that helped me toward my pre-med journey? It really solidified that I should do pre-med because I wasn't quite type A enough to do it in the first one. I wasn't quite type A enough to do the DC work, but also that it teaches you a lot about communication and customer service and finding compromise between people in really polarized environments. You know, we would get calls and I would answer the phone every day, and you would hear some of either the most heart-wrenching stories of people who are just really opinionated. And being able to be a mediator, which I feel like is an important role for a medical professional, is so important. Yeah. So that's one experience. Any other experiences?
Okay.
Gee, I've done a lot over the years. I find that unless you're like medicine, science, and humanities, or like a humanities major, you don't really care about history. I love history. I was a history major for a hot second. I got voted most likely to be a history teacher in 4th grade. Oh my goodness. Anyways, I'm getting off track. I find a lot of joy in that. I think pre-health students should take a sociology class or a history class of some sort. But this summer, I'm really excited. And what I've done in the past as well is I'm doing a historical review of pediatric hearing healthcare disparities in Baltimore. I'm using resources from the Chesney Archive, which I'm really excited about. But as far as like past projects and this current project and why it's helpful and hopefully my journey to become a physician, I think history, I've always loved history. History, it kind of tells us insights that we can apply to the future. I think that's so important in grounding people in how they treat patients. So yeah.
I love it. I can like see the enthusiasm like exuding from all of your face and facial expressions and everything. So
it's a lot of fun.
Excitement is there. Yeah, I'm glad. So then for our last minute or so,
wow. You asked me more.
I know. 15 to 20. I know everybody gets stressed out, but it's like it goes by really, really quick. So are you planning, because the question we did like bridge gap year conversations in one of the lives this year, and there's always the tug and pull of should I take a gap or bridge year or shouldn't I not? Are you taking one? And what
I think I knew before college that I was going to take a gap year anyways, or bridge year, whatever you call it nowadays. Yeah, I was like, I'm going to need a break after college when I decided to go to med school. That was the main reasoning. Also to save up a little bit of money for med school, just for like living expenses and everything. I'm very fortunate my parents can hopefully afford med school, so yeah, I'm very fortunate for that. But you know, living in a city is expensive, so saving up some money for that. Yeah. And I think even now, like when I got to sophomore year, what happened? I failed a class. I failed neurocells and systems, and that's how I ended up as a public health major. A big reason why. Of course, my interests had changed by that time, but it was also a big reason why. You know, so now I need to finish up senior year to get my GPA back on track, and yeah, and continue projects that I'm really excited about doing. Yeah, to give me a little bit less stress. So yeah, one gap year if I don't get any of the UK to Fulbright. If I do get the UK at Fulbright, I probably have to take 2, but. Yeah, 2 max. That's what I'm going for.
Okay, 2 max, but you got time. But it's all to decompress, keep focusing, keep enhancing, bolstering your experiences. I want to thank you, one, for being authentic and transparent about your journey, because not everybody is willing to share the woes and wins of being a pre-health student here at Hopkins. So thank you for being courageous. And then 2, also, being able to, one, be an advisor, and behind closed doors, I know the stories of many students. And so it's an opportunity for other pre-med students, pre-health students on campus to see that the journey looks very different for everyone, and you should really explore the things that you are curious about and that you're passionate about as they relate to your aspirations of being within healthcare and medicine. So thank you for exempling that. And then lastly, I think that you have done a tremendous value to the pre-health community here, the public health community. I'm sure that this is just a small like glimpse of what else you have the capacity to do, and Hopkins should be honored to be able to call you an alumni of their institution. And so
over here. Gee.
Yeah. So not only wishing you the best for your finals coming up, but also as you hopefully you get good news about the Fulbright Scholar so that you're able to just further your impact in the things that you're doing. And so obviously Pre-Prof is here to support you in any way we can, in more ways than just writing a committee letter, because I know that's mostly what people want us for. But we can do more, right? So we hope that through Zandy, she's there. Connect with her, obviously. You know, I know that you play other roles on campus and things, and so we really appreciate. Do you want to announce anything you would want people to encourage people to attend or connect with you?
I think my Instagram is Zandy_Wong. And yeah, just go enjoy Spring Fair. That's all I have. Yeah.
I just got was it Ickaby?
Oh, you did? You were just there? I was just there too.
Yeah,
I got my t-shirt. Oh my gosh, I probably saw you. Oh.
Yeah, no, I did, but I know I got the food. It's stupendous. So definitely do that this weekend. Hopefully you
All
stay
right,
dry.
thanks, Zuri. See you later.
Bye.